Biomechanics of treadmill, jogging, running. Our team is formed by Cindy Solis, Paulina Huerta, Saul Medina, and Brenda Benavides.
Human gait. The human gait can be described as a series of alternating rhythmic movements of the limb and trunk that determines a forward movement of the center of gravity.
Genu-varus or genu-valgus. Genu-varus and genu-valgus are knee conditions that cause the legs to arc outward or inward. Genu-varus is the position in which the ankle touch and the knees are separated from each other, making an outward arched leg position. Genu-valgus is a condition in which the knees touch but the ankles do not. The legs form an X shape.
The causes of being a genu-varus or genu-valgus can be a post-traumatic origin where the structure was hit affect and it doesn't recover in the right way. Hereditary, when have relatives with a record of this condition, and structurally, when they can originate when the leg is longer or shorter than the other lower limb. Consequences of being genu-valgus or genu-varus. In legs with well-aligned axes, the distribution of loads occurs equally. That is, support each leg approximately half of our body weight. However, when any of these alteration occurs, it may happen that distribution of load that each leg supports is altered, increasing the load that one leg supports and lightening the other one. If the maladjustment affects only one of the legs, the hip of the affected leg descends behaving as if it were a shorter leg. The two hips are the same height, but as we mentioned, the structure of the affected leg suffers from the premature overload and wear. If the maladjustment affects both legs, if the deviation is in valgus, this creates a more horizontal position of the sacrum that increases the lumbar lordosis. But if the bilateral deviation is in varus, this tending to the opposite.
What does pronator or supinator mean? The subtalar pronation and supination are movements that occur in the joint between the astragalus and calcaneus. The subtalar joint can make movements in three planes of space, so that the anterior portion of the calcaneus makes movements in three spatial directions. One of these directions correspond to the pronation and supination movements. When the calcaneus leans on its inner face, there is a torque of pronation, while that if is done on the external face, we are talking about supination. The angle that is usually taken as a reference for the pronation and supination is formed by the line of the Achilles tendon and the medial vertical line of the calcaneus. Consequences of being pronator: tibial tendinitis or tension in the ligaments of the plant, pain in the arches of the feet and heels, but often reach the calves, ankles, knees, reaching the back. Consequences of being supinator: ankle sprain. The ligaments on the outside of the ankle are injured by tearing or overstretching. Fractures: those with a supinator foot can experience stress fractures because the muscles are overused and do not absorb the impact. Pimple pain: this pain occurs of the inner side of the tibia. Muscles, tendons, and ligaments become inflamed and painful, especially while walking or running. Fasciitis: plantar fasciitis occurs due to the inflammation of the plantar fascia.
Methodology.
First, we recorded a video for at least one cycle of the gait with the subject on the posterior view with markers on the knees and ankles. Then, the videos were analyzed in Kinovea software. We're analyzing the angles between two lines. The first line is from the midpoint of patella to the tibial tubercle, and the other line is from the anterior superior iliac spine to midpoint of patella, both making a line like the top figure to get two angles, the Q angle and the complementary angle. Both angles, Q and complementary, are to know if the subject has a genu-varus, valgus, or neutral according to the table 1.
Where measure the angle formed between the line of the Achilles tendon and the vertical line of the calcaneus, as the figure can show, to know if the subject is pronator or supinator during the motion, and according to the angles on the table 2. Both subjects made a footprint in a sheet of paper of both feet using paint that is similar to the perigraph, that consists of tipping on a rubber device, impregnated in ink, under which there is a paper that after the treat is impregnated with the ink and marks the footprint. Then the footprints obtained with the paint were compared with the image presented and know if the subject is pronator or supinator. Results and discussion. In subject 1, it can be seen that in both legs a Q angle of 10 degrees and a complementary angle of 170 degrees are obtained when the leg is fully stretched, and the two lines can be correctly marked on the first line from the midpoint of the kneecap to the tibial tubercle, and the other from the anterior superior iliac spine to the midpoint of the patella. Comparing the angles obtained with the theoretical ones in Table 1, which shows the complementary angle and the subject shows 170 degrees, it is assumed that it is valgus, although it is in the limit. In Subject 2, it can be seen that in both legs a Q angle of 14 degrees and a complementary angle of 166 degrees are obtained when the leg is fully stretched, and thus be able to mark both lines correctly as the previous subject. Comparing the angles obtained with the theoretical ones in Table 1, which shows the complementary angle and the subject shows 166 degrees, it is assumed to be valgus, since it is within the range being less than 170. Both subjects are valgus, so something to highlight it is that in this condition there is an internal rotation of the femur that causes a displacement of the iliacs that move the sacrum backwards, increasing lordosis or the natural curvature of the spine, since the sacrum retains a more horizontal position.
Angles of supination and pronation can be found. Even when it's just the normal gait, there is going to exist a little of supination or pronation, but when the subject is running, those values grow. Images presented shows the ankle formed by the Achilles tendon and the vertical line of the calcaneus in both ankles. The first subject in the left ankle has an 8-degree angle and in the right ankle has a 10-degree angle while it's running, and the angle is drawing to that side, so the subject number 1 is a supinator. Subject number 2 shows a 3-degree difference between the left and the right foot angles. Right foot has an 8-degree angle while the left foot shows a 5-degree angle. The subject's angles are tilted outwards, and comparing the way the angles are and the degrees of each one, it can be assumed that this subject is a supinator, but less than subject number 1. This difference in both angles of both subjects can exist in the ankles and can be attributed to poor posture when the feet have a different support and how much the foot needs to reduce the impact produced by walking or running. Footprints. Left figure represents subject number 1, that presented an outward pressure in the plant of her feet resulting in a supination of her feet. In this case, can be observed that the footprints look similar to the neutral foot more than the others. Subject number 2 has a discoloration of the tint due to the pressure applied and can be observed on the outward plant of her feet. Based on the result, can be concluded that subject number 2 is a supinator.
Conclusion. The development of this project allowed the analysis of one of the most common misailments in the knee joint, the condition of genu varus or genu valgus, causing an abnormal distribution of loads in addition to the contact area, since the pronation is due to the rotation on the inner side of the calcaneus, while supination rests on the outer side. The Kinevia software was used, which is used for sport analysis, so that is to allow to determine the size of the angles in the knee and ankle, and to determine the condition of the person in a theoretical way, and based on the angles they should measure certain lines, and not only for observing the shape of the legs. When you're a child, if one of these conditions is detected, it is important to go to a specialist and see what options exist to treat that condition.
These were our references.